Superior vena cava syndrome. Superior vena cava syndrome, or SVCS, is obstruction of blood flow through the superior vena cava. It is a medical emergency and most often manifests in patients with a malignant disease process within the thorax. A patient with SVCS requires immediate diagnostic evaluation and therapy.
What is superior vena cava syndrome? Superior vena cava syndrome is an obstruction of the superior vena cava that impairs blood drainage from the head, neck, and the upper extremities. So basically, the superior vena cava cannot drain into the right side of the heart because there is an impairment in the blood drainage due to compression or obstruction. What are some common causes of superior vena cava syndrome? Superior vena cava syndrome commonly is caused by malignancy, which will cause the compression of the superior vena cava, or due to thrombosis from indwelling catheters. What are the signs and symptoms observed in superior vena cava syndrome? In superior vena cava syndrome, due to the impairment of blood drainage from the head, this will lead to facial plethora or facial swelling, along with headache, dizziness, increased risk of aneurysm, and rupture of cranial arteries. Also, due to impaired blood drainage from the jugular, you would see jugular venous distension. And lastly, there would also be blockade of blood from the upper extremities, therefore leading to edema. And remember, this is a medical emergency, so treatment needs to be provided right away.
For more information on this topic,
A 59-year-old man with hypertension and Crohn's disease that was complicated by fistulas was found unconscious at home. He was being treated with infliximab, administered through a central venous access device which had been placed for long-term intermittent treatment. He was intubated and brought to the emergency department. Vital signs were stable and the physical examination was notable for cyanosis of the head, neck, upper torso, and arms. Rhinography showed occlusion of the superior vena cava, finding consistent with SVCS. Ultrasound accelerated thrombosis was performed along with bare metal stenting of the superior vena cava, which alleviated the obstruction. After 2 weeks of hospitalization, the patient recovered with only residual visual impairment in the right eye as a result of prolonged congestion of the retinal veins. SVCS is often due to external compression from cancers, but may be caused by intravascular thrombosis associated with the placement of a central catheter.
Superior vena cava syndrome, the symptoms that result from compression of the large vein that carries blood down to the heart. The superior vena cava is a large vein that transmits blood from the upper body back to the heart. The superior vena cava is located in the middle of the chest and is surrounded by rigid structures and lymph nodes. The structure bordering the superior vena cava include the trachea, aorta, thymus, right bronchus of the lung and pulmonary artery. Compression of the superior vena cava by disease of any of the structures or lymph nodes surrounding the superior vena cava can cause the superior vena cava syndrome. The superior vena cava syndrome is characterized by swelling of the face, neck, and/or arms with visible widening, dilation, of the veins of the neck. Patients often have a persistent cough and shortness of breath. Other symptoms can be present including hoarseness, swelling around the eyes, fatigue, chest pain, headaches, and dizziness. The causes of the superior vena cava syndrome include cancer, malignancies, and non-cancer, benign, conditions. The common forms of cancer that can cause the superior vena cava syndrome are lung cancer, lymphoma, cancer of the lymph nodes, and cancer that has spread, metastasis, to the chest, more commonly breast and testicular cancer. Non-cancer causes of the superior vena cava syndrome include infections, such as tuberculosis, fungus, and syphilis, benign tumors, such as teratomas, thymoma, dermoid cyst, aortic aneurysm, pericarditis, sarcoidosis, irradiation treatment to the chest, air in the chest, pneumothorax, and complication of central line catheters and congenital heart surgery. The diagnosis of superior vena cava syndrome can be made with the typical findings above. The diagnosis is supported by identifying a cause for the superior vena cava syndrome, typically requiring X-ray imaging or CAT or MRI scanning. The treatment of superior vena cava syndrome is directed toward the exact underlying cause. Therefore, treatment might include radiation treatment, antibiotics, chemotherapy, clot busting, thrombolytic, drugs, blood thinners, anticoagulation, and balloon angioplasty, and even surgery.